Hello everyone, my name is Susan Daniel and with me today is
Dr. Mercy Abiodun.
We'll be talking about hepatitis. Doctor, please can you tell us what is hepatitis?
Alright, thank you for the question. Hepatitis is a condition that is simply a disease as a result of liver inflammation, and it could either be alcohol-induced or viral in nature. If it's viral, we have about 5 classes. We're talking about A, B, C, D, and E. Now, they have different characteristics, but their symptoms are actually similar. But for the essence of our topic today, we'll just be focusing on the B, hepatitis B.
Hepatitis B. So, what exactly is particular to hepatitis B?
Alright, hepatitis B is the deadliest of the 5 classes I mentioned, and it can be transmitted through bodily fluids.
So, can it be transmitted through blood transfusion? Can you contact it through blood transfusion?
The risk of that is extremely low, because for a blood to be transfused, the blood has already been screened, and one of the things we screen for is hepatitis. So if there is hepatitis, the blood will not be transfused. So because of that, it's nearly impossible to get hepatitis through blood transfusion.
Okay, so hepatitis B, is it also hereditary? Can we contact it through gene?
No, hepatitis B is not genetic or hereditary in nature. However, it can be passed from mother to a child during birth. Don't forget, I said it can be spread through exposure to bodily fluid. Okay. Even this can still be prevented by one, knowing the status of the mother and vaccinating the newborn.
Okay, so now, is it curable? Is there a cure for hepatitis?
Sadly, we don't have a cure yet. However, medicine is evolving. So tomorrow we can even get a cure. But for now, the symptoms can effectively be managed.
Okay. So who get vaccinated? What class of people can get vaccination from hepatitis B?
Everyone should get vaccinated, from an infant within 24 hours of birth and then getting subsequent 2 doses, to children, adolescents, adults. But there are some particular people that risk of getting hepatitis. I'm talking about people that handle bodily fluids, like healthcare workers like myself. I'm talking about people that are in institutionalized settings like prison. I'm talking about people that have multiple sexual partners, people that uses drugs, especially injection, people that have, sex with men, men-to-men sex. Yeah, so these people are particularly at risk and they should all be vaccinated.
Okay, thank you very much. This virus, can it survive on surface? Can it survive?
Yes, actually, hepatitis B, it has been well documented that it can survive outside the body for up to 7 days. Even hepatitis C, up to 16 hours on surfaces. And that's why it's advisable that you clean your surfaces with bleach, what is disinfectant, very, very effective to be able to combat that.
Well, that's good to know. Doctor, you know what? Someone told me one time and said, I'm positive to hepatitis B, so I'm not going to get wife, I'm not going to get children. How true is that? How possible is that?
Hepatitis B is not a death sentence. Yes. You can get married, you can have your children, you can live your normal life. However, we advise that people close to you should also be vaccinated.
Okay. And what advice do you have for people that think they are always in the hospital, so they don't think they have, if not, their doctor would have told them. What advice do you have for them? Because
you go to the hospital every time does not mean that they will test you for hepatitis. Because hepatitis test is not a routine test. So it's either you have symptoms like jaundice, I'm talking about yellowing of eyes, I'm talking about abdominal pain, or if your urine is dark color, and then the doctor will feel like, okay, let's rule out hepatitis. Then the test can be carried out. Or if you walk in and demand that, okay, I want to run an hepatitis test. So for instance, if you come to us at Kenmelt and Diagnostic Center, we actually run that. So you can either come to us because you have all these symptoms, or you want to walk in to run the test. Thank you very much. So you have to be specific in running hepatitis to know if you're positive or not. Yes, or if you have symptoms, then we can run it. Okay, thank you. Thank you everyone for listening. It's been a detailed one. If you need further information in counseling, you want to run a test, you can walk up to us at Camp Health
and Diagnostic Center. We will be there to attend to you. Please kindly like and share. Our address is on the screen. Thank you.